Dr. Pensick, Dr. Pensick, I will say that we can go over that 25-minute mark if needed. So that's good news. All right. Perfect.
Sounds good.
All right, wonderful. All right, so welcome everybody to this week's Power of Peptides. It's a space where we can explore the incredible potential of peptides and how they can help us thrive as we age. And so, for those of you who don't know me, my name is Joe Udovich. My journey into health and wellness began in 2022 when my father was actually diagnosed with stage 4 gastric cancer. In 2023, I tested positive for the BRCA2 gene mutation, which he found out that he had carried during his chemotherapy when they did genetic testing. I chose to undergo a double mastectomy and a complete hysterectomy, which launched me straight into surgical menopause. I was not ready for it. My body or soul was not ready for it. After losing my dad in October of 2024, I became truly a shell of who I once was. I had walked through a fire, and like anyone who's been through one, I didn't come out the same. I needed a way to heal, and that path led me to peptides and the power of speaking my truth, which wasn't very easy. It took me months to do, I'm not going to lie. And so for me, that included using a GLP-1 to help me reduce the weight and inflammation brought on by perimenopause and the complete hormonal shift after my mastectomy and hysterectomy. So since then, I have taken my Instagram platform that once was education and I have moved it into the health and wellness arena. And I now share my story and my father's with the hope that it helps others heal from their own battles. So it's enough about me. That's my story in a nutshell. And it's time to introduce our guest, which we are so excited. You guys may have seen him on Instagram. And if you know anything about peptides, you probably have. Okay. So tonight we are joined by someone who is not only someone that understands the science behind peptides, but lives it every day in clinical practice. This is Dr. Jason Pensick. Jason is a board certified nurse practitioner and chiropractor with a deep expertise in both conventional and integrative medicine. Since starting as an RN in 2010, he pursued extensive training in regenerative medicine, hormone optimization, IV nutrient therapy, and peptides, including over 6 years of hands-on clinical peptide use. And nearly half of his practice focuses on GLP-1 therapies for metabolic health, weight loss, and disease prevention. He's actually currently on a panel, and he is a moderator at the World Biohackers Congress, that's right, in Chicago, and is truly at the forefront of functional medicine. So tonight, what we're going to do is we're diving deep into one of the most talked about topics in wellness, GLP-1s. Oh my goodness, my platform is buzzing with this, and I get so much feedback, and I know that he does too, so this is going to be great.
Yeah.
So these peptides are everywhere in the media, but the truth is there's a lot of confusion, there's a lot of controversy and curiosity surrounding them. And so a recent reel that I had posted, it was a side by side with myself and Dr. Pensick, and we were just, well, he was discussing the GLP-1's risks and benefits, and it went wild. I mean, wild. So I knew that we needed to bring this conversation to the power of peptides, and that is why Dr. Pensick is here. So without further ado, Dr. Pensick, you're going to take the stage. We're going to talk all
Oh, perfect.
things risk and benefit. And I actually made a list because I'm like, okay, there's a lot of stuff that that we could talk about here. So welcome, welcome. Thank you for being here. Let's start. I want to just start by saying I'm sure that you hear a lot of things in your practice, Blair. Is there any way that we could pull just him up with the view? Are you guys all seeing what I'm seeing? It's just like a,
So
I
you
see
just click
you.
yourself, Joey, at the top right, you click view and
okay.
change it to speaker. So on mine, it's already like that.
Okay, got
And I'm
it.
just going to hit mute really quick. So, doctor, when you come on, just hit unmute because there's a couple people that are not muted. I'm sorry.
Perfect.
Joey, you can hit his three and say spotlight for everyone.
Hit his three.
His three dots at the top.
Oh, got it. All right. See, I'm still
There you
learning.
go.
Got it, guys. Yep, I got it. Okay, perfect. All right, we good?
Yeah.
Okay, so welcome. Thanks for coming.
Well,
You have
thank
a
you for
lot of,
having me,
look,
Joey.
we hit our 100, by the way.
Good, good. I have right behind me all the benefits and risks of the GLP-1s actually earlier today to make my next reel. So this was perfect.
This is perfect. That's the infamous whiteboard. If you guys visit him on
Yes.
Instagram, you will see the whiteboard. Okay, wonderful. So I'm just going to bring up some of the things that, I hear often, and then I'm going to let you shine light on whichever one you want to talk about first.
Of course.
So we've got things like inflammation, how long we should be using GLP-1s, any long-term side effects, hair loss, muscle loss. You take it. You take it. You
Okay.
tell me what you want to talk about here because we got a
Thank
lot.
Thank you, Joey.
Yeah.
I think the first thing people want to always hear is like, what are the risks? I think that's the biggest thing, that the fear, right, that everyone has right now is what's going to happen, right? There's been so much being said about the GLP-1s. Glucagon, like peptide 1, is actually made in our body. We've known about it for many, many, many years. There was some research on the Gila monster and its venom, and they found that, hey, this actually does a lot of cool stuff. Now, there are a lot of people out there trying to say that's still the venom being used. It is not the venom being used. This is actually completely different than the venom now. It is similar that it's a GLP-1, but that's kind of where the similarity stops. What the GLP-1s do for our body is absolutely incredible. Now, there are going to be risks for anything you take. They are very low from the GLP-1s. We see things such as pancreatitis happening. Now, this is very low, 0.2% of people can get this, so very rare. We also can see things with medical gastroparesis. Basically, your stomach completely slows down. Now, we do understand the GLP-1s in general slow down our stomach emptying. This is something that's actually happening as part of what is supposed to happen. Medical gastroparesis, though, is when it stops to the point that you have to be hospitalized. You have to have medical intervention. And this is happening about 0.5% of the time. So again, super low risk. And it also is dose dependent. So as you move up in dosing, you're more likely to have this happen. We also have a big worry right now. The black box warning is with thyroid cancer, actually medullary thyroid cancer. We haven't actually seen it in humans so far. What we believe is happening in rodents was where it was found. They have a more uptake to the thyroid, about 3 times more than humans do. And because of this increased uptake in the rodents, they are getting the thyroid cancer. And we have not, again, seen this in humans and long-term data. We've been seeing data since 2007 with exenatide, the first GLP-1 to come to market, and they didn't have an increase of cancer risk since 2007. So we do believe this risk is very, 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 very low if it exists at all.
Can I ask a question real quick,
Yeah, of
not to
course, of
interrupt you?
course.
Okay,
No,
so
please go ahead.
so I get that all the time with the thyroid, and
Yeah.
so my question is, and correct me if I'm wrong here. I feel like a lot of times when we're seeing issues arise, number one, I think it's a lot of predispositions that people
Mhm.
are, coming into that medication
Yeah,
with.
of
And
course.
also I feel like high dosing. Like if you're dosing really high, it's not necessarily the answer for weight loss. And I feel like it could maybe attribute to certain the issue, some of the issues that we're seeing people get.
Of
Does
course, yeah.
you agree with
See,
that?
yeah. So of course, you have to remember that. I mean, there's going to be obviously adverse effects. The thyroid one, the research is actually showing it actually can help improve thyroid conditions in many people. Reduced inflammation is great, especially with people who have hyperthyroidism. We often are seeing Hashimoto's is associated with hypothyroidism. If you have hypothyroidism, you likely have Hashimoto's. It's a very high incidence together. So when you're taking a GLP-1, you're reducing this inflammation. You're actually working on part of the immune system, the Treg cells, Th1, Th17, and you're helping improve the overall function of your immune system, which means you actually are going to have reduction of how your body's handling the immune response to your thyroid. So actually, there's some improvements in thyroid
Wow.
that can be happening with taking a GLP-1. So the risk factors that do exist, they are real. Again, thyroid cancer probably not going to happen. Pancreatitis is going to happen potentially in some people. We have some medical gastroparesis. We talk about this loss of vision is a new thing that people have been discussing. Nanions, non-arteritic, ophthalmic. Oh my gosh, I can't think the rest of it now. But the whole nanion, the idea behind it is you have vision loss due to this. And they actually had a new study just come out in February that completely disproved this actually happens due to GLP-1s. It
Wow.
was seen in a few earlier studies before this, and the biggest study they've done now in millions of people retrospectively, they found no direct correlation that's high enough incidence to say that they're caused together. We do see vision loss increasing diabetic neuropathy. Now, in diabetics, when you have diabetic neuropathy and you have a risk of vision loss that's going on, when you actually get blood sugar to become better in these patients, they have a loss of vision. This is just generalized. You could take metformin, you could take any kind of blood sugar regulation drug, you could change the blood sugar in these patients, and many of the times their vision gets worse. So this is not singular to a GLP-1 in general. There's actually some improvements in things like glaucoma, about a 30 to 40% improvement. We see improvements in macular degeneration as well. So there's there are a lot of conditions that are being treated that people are saying, oh, this is causing an issue. What are we doing about it? Well, most times this issue probably isn't even happening. Now, again, other concerns people typically have is I'm losing muscle. I think that's the number one complaint
Yes. Oh
that
my
we hear
gosh,
across the
yes.
board, right? Every person here says, oh my gosh,
And
I'm losing my
hair, and
muscle.
their
Hair,
hair.
correct,
Yeah.
correct. So the hair loss we'll go to first is anytime you lose weight, it doesn't matter how you do it, you can have hair loss. Your body's trying to stop producing anything it doesn't need to produce when you go into starvation. When you use a GLP-1, part of what happens is appetite goes down. When you are reducing appetite and you're reducing weight, you potentially can have hair loss. For some people, this is 10 pounds over the course of 3 months. For other patients, this is 50 pounds over the course of 3 months. It really depends on the person. So what I'm typically doing in practice is we're just stopping weight loss and holding it steady until the hair starts returning and then continuing with it. Again, this is not dependent on a GLP-1. This is going to be due to the fact that you're just losing too much weight. And again, not probably enough nutrients. You're not eating enough food. When we do not eat enough food, and we're sitting there trying to plan meals, we're typically not thinking of the foods that we should be eating with, high nutrient, high density, especially for most people out there that are getting GLP-1s from primary care provider. They're not changing their diet. They're doing nothing differently. They're not being told to eat more protein. They're not being told, hey, you need to have more fruits and vegetables. You're not getting the nutrients.
So
You could,
to
yeah,
navigate that, and I'm just going to interrupt because
of
I
course.
know you've got so much to say, and that's wonderful. So just to navigate that, again, would you tell somebody who's experiencing that trouble of getting that right nutrition in
Yeah.
to maybe dose lower to titrate down? Because I feel like you should have your body needs food, so I feel like you should have,
Mhm.
your food noise, that perfect balance of, okay, the food noise is at bay, but I still know that I need to eat, and I can eat. I'm not to the point where I don't even want to look at food. But I mean, what would you tell your patients if they're experiencing that? I know you said you're going to pull them off. Did you say that you're going to pull them
Yeah, I'm
off
going
of?
to pull them down to weight loss, non-weight loss dosing, right? So we
Okay.
we use semaglutide and tirzepatide long-term in patients in my practice, and I bring them down to a non-weight loss dose. So whatever that looks like. For some patients, that's typically zero point 0.5 to 0.25 milligrams of semaglutide, maybe 2.5 milligrams of tirzepatide or less. Typically at that dosing, people aren't losing weight. There are people that do lose weight at that dosing, so I'd go down even further because I want to keep the benefits in these patients while they're still taking the GLP-1, but stop their weight loss. So weight loss has to just stop at that point. There's no more weight loss
Okay.
until we get the hair under control. Now, again, there's lots of different products you can take for hair. There's biotin. One of the pharmacists I work with has something called Hair Force One that has a few nutrients in it. Now, anything at this point to help your hair that will be really useful. I like GHKCU. It's a great one I use for patients that aren't losing hair. I put on GHKCU, which is a peptide to improve collagen production. We start to see the hair come back a little bit faster, but automatically we just have to stop weight loss. The second thing, obviously, we have here is muscle loss. And again, this is nutrition counseling. This is number one thing that has to be done with any patient on a GLP-1. You have to be eating enough protein. I think the big problem is when you stop eating as much food, you just cut everything down. It's not cutting down everything that matters to me. It's cutting down, the foods that I don't want to eat, carbs and fats typically need to go down a little further, and I want my protein to stay high. I'm always counseling patients. I want 1 gram of protein per pound of ideal body weight. So if your ideal body weight is 150 pounds, you need 150 grams of protein. I understand it's very difficult for lots of people. It is not easy to do. It is meant to be a goal. I need you to be trying for that every day. If you are not trying for that and you're grabbing pasta dishes, yogurt, your higher carb meals before you go to any kind of protein, you're going to miss out on that protein because you get full very quickly and you won't be able to get all that in. So
Now, I do want to say too, for people, and I don't know what everybody else's experience is, but for myself personally, I mean, I did a lot of emotional eating during my dad, his
mhm.
situation, and then my surgeries. I mean, it was just a very bad relationship with food. And I find that like that dopamine trigger, as I've been on that GLP-1, has completely reworked itself. So I'm more apt to go for the protein and the fiber and all the things that I should be going for. Do you find that to be something that happens too?
Yeah, it's on the board actually, dopamine
Oh,
improvement. So, yeah, one of the things that actually does happen, it rewires your brain. What happens, it works on dopamine signaling in the VAT, which basically is going to help improve how you're handling dopamine. Now, in some patients, they can get depressed or get a little more anxious as they lose that dopamine. So, again, this is one of the adverse effects we see. It's very, very low risk to see this happening. But some patients, because that dopamine does go down in the presence of a GLP-1, they do have a little more depressed feelings.
Okay.
But in general, for most people out there, it's a huge benefit. That dopamine reward system gets rewired after you have been away from those dopamine-rich foods, the high carbs, high sweets that you have. It's 100 days to reset this pathway. So once you spend about 100 days resetting that, those pathways are now locked in and they're going to change the behaviors, which is really, really important for weight loss. Obviously, the biggest thing is I don't want you on a GLP-1 to maintain weight loss long term. I cannot say that enough. There are lots of reasons to be on GLP-1s long term, but to suppress appetite is not one of them. I need patients to understand, and people in general, that this is not meant to be a long-term weight loss holding pattern. You cannot keep appetite suppressed forever. That is not a real thing. So we have to learn to get better eating behaviors, such as increasing that protein content. We need more protein that'll make up for the carbs and fats that you are not going to be able to eat because you can't get enough in your diet anymore since you're full. So when I finish these programs with patients, they get to the weight goal. My goal is to keep them at that improvement of protein. The biggest thing when it comes to weight loss with anyone out there, anyone that's ever done this weight loss in general, if I restrict you from foods, it's a lot harder to maintain that. If I say, hey, you can eat as much as you want of this, people are very apt to do that. Hey, I want your goal to be this. I want you to eat more and more of this. When you give patients food back, they're going to do much better than saying, hey, you know what? We're going to redo your entire structure of your diet, carbs, fats, and protein. And this is the new structure. You're not going to maintain that long term. It's very difficult to hold to that diet lifestyle. So if I can just tell you, hey, stick to one macro you have to worry about, just think about this, patients do better. Now, when it comes to muscle loss, if you're doing some type of strength training, and I'm talking about 2 to 3 days a week of strength training, as well as keeping this protein content high, you're going to do a great job at holding that muscle mass. We see very little loss in muscle mass in our clients because they are doing this. The patients that are having a hard time keeping the muscle mass on are not hormonally balanced. So I'm talking about testosterone here. If I get patients, I'm checking the hormones. I want to see where your testosterone levels are. If they're not balanced, you won't be able to hold muscle mass as well. And then I also need weight-bearing exercise and strength training. The minimum I require from my patients is about 30 minutes, 3 times a week of walking. And that alone does enough for many people to hold the muscles. So strength training for some people can't happen. Maybe they're a little bit too overweight or they have too much pain still in their body. Now the GLP-1s will help the pain, help the inflammation, but to even get to that point, I want them to at least walk. So high protein and then also some kind of exercise are the bare minimum to be on a GLP-1. And one of the things that I haven't mentioned yet here is when we're talking about cancer risk with thyroid, they're actually now finding decreases in risk in GI cancer, breast cancer, genital cancer, skin cancer,
Wow.
blood cancers, as well as if you lose 5 to 10 pounds in general, you have about a 5 to 10% risk reduction of cancer across the board. So
Wow.
just the weight loss you have is enough reason I would tell patients, hey, like, I know you're really scared about GLP-1s, but if you're to take off 5 to 10 pounds, maybe 5 to 10% of your weight, you have at least a 10% reduction of cancer. And that's across all cancers. So there might be some fear of potentially increasing risk of cancer and thyroid, which some people still, even if I say this, I'll say it now, they still don't believe me. Will that risk increase that you have from thyroid cancer potentially happening, or any of these other risks we see, pancreatitis, or even, medical gastroparesis, are going to be outweighed by just the reduction of cancer.
So
Not
do
to
you think
mention,
that that has to do with the inflammation being brought down in your system too?
that's just across anyone that does weight loss. If you do weight loss, this is just a general weight
Okay.
loss idea. If you
Okay.
lose
Okay.
5 to 10 pounds, yeah, this is not specific to GLP-1s. This is just if you become normal weight, right? So let's be real here. 75% of people roughly are overweight right now. About 40% of people are obese in America. So we have a massive obesity crisis. We have a massive overweight crisis going on. GLP-1s, why they're being such a kind of a hot topic is you can lose so much weight so quickly. And when that happens, a lot of adverse things happen, right? You lose a lot of muscle tone. People talk about Ozempic face, right? Ozempic butt. We get jokes about that all the time, right? And that's because you've lost so much fat. And it's not specific to GLP-1s, it's just losing weight. You see this kind of gaunt face now going on. Well, again, not GLP-1s and specifically are causing this. It's just weight loss in general. If you haven't seen what 20% weight loss looks like on you for I don't know, 5 years, 10 years, you do lose fat in your face. The fat pads get smaller. So if it's been a while since you've seen yourself,
Mhm.
well, your face is structured a little bit differently from 5 or 10 years ago.
Right.
So this Ozempic face is going to happen if you lost the weight on your own naturally. The same thing would have happened. It's not like GLP-1s pull fat from your face or from your butt. I have a lot of clients. My women are obviously very, I don't lose my butt. Don't let me lose my butt. And I have to remind them, go do your squats. Go do
Yeah.
your squats. I'll help you out. Because I'll have patients, we often see people who can gain muscle mass while they're on a GLP-1, as long as they're hormonally optimized and they're eating enough protein. I've had patients who lose a lot more fat and then start building more muscle mass. I had a guy who did a bodybuilding show. He lost 40 pounds and was the most jacked he ever was. He was turning 50. He was really excited for his
Yes,
50th.
I love that. And people
So,
don't realize that I have
yeah,
friends who are actually building muscle while on a GLP-1, and I
exactly.
love to hear stuff like that. That's
Yeah.
wonderful.
Well, what really helps with, we have to understand type 2 diabetes and insulin resistance. What's going on here is you can't get enough basically sugar into the muscle. So when you give a GLP-1, you're allowing for that muscle to pull in that sugar and actually utilize that glucose it's not able to get. So at low dosages, you can actually build muscle and build strength on GLP-1. It's actually useful for that. If your blood sugar is normal, it probably won't make a massive difference. But in those people that are borderline, the beginning, the starting, the stages of insulin sensitivity, this will start reversing that. So the GLP-1s, there's just so much benefit that they can do. I mean, we see
Yeah.
reductions in heart disease. I mean, there's a 30% reduction in heart disease. So when people come at me and they're saying, hey, this stuff's really dangerous, I know someone got pancreatitis. I know someone went to the hospital. These cases are happening. It is not that they are not happening, but what you're missing is the people that come back and say, oh my God, this changed my life. They're going to see 10 years from now, the patients are going to have risk reductions of, heart disease. Hey, guess what? Now your mom or your dad didn't die from getting cardiovascular disease, heart attack, stroke has been decreased in them. Yeah, maybe they went to the hospital and possibly had some issues at the beginning. When they first started the GLP-1, they dosed too high, they went a little too strong with it. But 10 years out, now we're seeing the risk reductions that are really mattering. We're not seeing those risk reductions because they take time to get in place. Just like the adverse effects,
Yeah.
right? I might
Yeah.
say in 10 years, hey, the risk of thyroid cancer is actually 0.3%. Oh my gosh, we didn't know it was there. But if I'm talking about risk reduction of all cancers together, 5 to 10%, just for a little bit of weight loss, I think that far outweighs any kind of adverse effect that we're seeing from some of these things. So we
Oh, yeah.
do see giant benefits. I mean, we see liver disease go down. We see liver enzymes get better. This is huge in patients. A lot of people start getting fatty liver disease. It's very common. At least, one of the most common disease processes that we see. I see high liver enzymes all the time. And we put you on GLP-1, these get normalized. I think a lot of us see, issues with our overeating. This is a math. Again, why are 70% of us overweight, 75%? It's hard to control our diet. We also have highly processed foods. I'm hoping this, new administration will actually help with this processed food problem that we have. But when you have very highly dense calories going into your diet that are highly processed, it is very easy to overeat. And next thing you know, you've had 500 calories and you've had, 5 bites. You went to the Cheesecake Factory, had three bites of
Yeah.
your cheesecake, and now it's like, how did I just help my macros in this single sitting? So
Right.
I tell people all the time, like, these things are helping rewire our brain. They're good for addictions. I use them right now for my
Yes.
alcoholics. I have patients that, drug users. I have alcoholics. I've seen patients go from binging 25, 30, 40 drinks a week to not drinking at all in a month. It's absolutely crazy how much I've seen. Now, this isn't great for everyone. Not again, the benefits don't happen for everyone. We just have to be very clear. Just like the risks don't happen to everyone, neither do the benefits. But in general, the benefits outweigh typically anything I'm seeing. And again, from just the standpoint of changing the way we think about foods. I mean, I've been on the GLP-1 myself for the last 3 years now, almost 2.5 years. And it's not because I tried to lose weight. I was in great shape when I started, but all the benefits that we see from this are amazing. My reduction of cravings has gone down significantly. I tell patients all the time, if you want to reduce your cravings for God knows whatever it is, your GLP-1 is great. I just had a friend of mine tell me he wants to get a six pack. And he's like, I gotta do more, more abs. I said, absolutely not. You have to change your diet.
Yeah.
There's
It starts in the kitchen. Abs start in the, the kitchen for
exactly,
sure.
exactly. And so I'm telling this guy this, and he's like, well, I barely eat during the week. I take my Adderall and I'm not eating. And I go, but you're drinking like 30 drinks a week. He's like,
Right.
well, yeah, I am drinking a lot. And I
Right.
said, well, try semaglutide. you might have a huge reduction of this alcohol binging. And he started it and he's already seen some risk, some reduction of how much
Yeah.
he's like, I don't want to drink. I said, yeah. He's like, this sucks. I said, absolutely not. Like this is good for you. Because I do hear this from patients all the time. I had a patient who doesn't like coffee anymore. I had a woman who stopped biting her nail. Been biting her nails for years, just stopped happening. So I've heard
Wow.
all sorts of crazy things from people on GLP-1s. And I want to be very specific. I love the GLP-1s in general, but when it comes to GLP-1, semaglutide is a much better option for reduction of cravings than tirzepatide is.
No
Um,
kidding. Oh my
yeah,
gosh, that's wild. I didn't know this.
yeah,
I
and
didn't know this.
we have to say this. This is because Monjaro is a GLP-1 plus the GIP. Now, the GLP-1 is not nearly as strong as semaglutide, which is why way more people get very sick on semaglutide. We have more nausea associated with that because the GLP-1 is much stronger. So you have that GLP-1 being turned up. And I think we'll see long term that semaglutide will have some good, really risk reductions when it comes to like addiction comparatively to Monjaro. Now, Monjaro, adding in that GIP does help with diabetes a bit better. So I'm a diabetic patient. That's the one I'm going to go to. I really do like Monjaro better. Again, less nausea. Patients love to not be nauseous.
Yeah,
I always joke, psychologically speaking, if it was really easy to lose all the weight, it would be really easy to put it back. So if I see patients get a little
exactly.
nauseous, I'm like,
So,
yeah, I doesn't feel great, but
yeah,
nausea is one of the adverse effects we see from the GLP-1s, which again is not fun by any means. And typically it's because we overeat with our stomach slowing down, and all of a sudden we're getting sick from that.
right.
Um,
And I do have a question because
yeah,
this is something that I hear all the time. I'm just kind of backing up because you said that we don't all see the benefits. I
yeah,
do have people that may be on like tirzepatide or semaglutide for months and they don't see any weight loss. And they're telling me that they're doing all the things.
yeah.
What would you
That's
say?
Yeah, that's very true. So we get that obviously. Medical practice has
Yeah.
a lot of patients that have failed GLP-1s. This is the sad thing, right? GLP-1s do not work for everyone. I have to be very clear about this one as well. They're not the magic bullet. Not every person taking a GLP-1 is going to say, wow, I've lost 50 pounds. I've had patients who's 170 pounds on a GLP-1 like Monjaro. I've had patients get on Monjaro, get to the top dose, tirzepatide, and they have 0 pounds they lost. And of course, they're very frustrated. They've been on this medication. It doesn't do a single thing, especially if they're paying for this out of pocket. They're really angry. And some people
Yeah.
just don't have improvements. Now, I've had patients who don't see any weight loss, but they have reduction of inflammation. That's a big thing that we see with the GLP-1s. We see interleukin 1 beta, TNF alpha, interleukin 6 all go down. These are inflammatory cytokines that are going to go down. And especially for someone like you, Joey, who's gone through, early menopause, this is huge. When you go through menopause, you actually have an increase on all these inflammatory cytokines. And when you lose estrogen and estrogen goes down, then you have these inflammatory cytokines go up. So my perimenopausal and my menopausal women are the ones who want to stay on this stuff long term. They don't ever want to come off
I
because the
don't want
inflammation
to
is
come
down.
off. So what would
Exactly.
you say? Just stay on that low dose, like a
Oh yeah.
microdose?
Oh yeah. I mean, I've been on low dose. I was before we had semaglutide and we had tirzepatide. It was liraglutide. This is actually the first peptide training I ever went to was talking about liraglutide. This was 6 years ago. So I got on that years ago. And I didn't stay on it long term because I didn't see the benefits or really understand the benefits at that point. But it was
Right.
the first one, it was the very first seminar we talked about GLP-1s on the horizon before semaglutide came out. And we were talking about all the benefits. I mean, there's just, reductions of cardiovascular disease, reductions of liver disease, reductions of Parkinson's, Alzheimer's, inflammation comes down, brain inflammation comes down. I've had patients say they feel the best they felt in their life or in
Yes.
many years because they're on GLP-1. I can put people on, I've had patients who don't want to lose weight. This is very common in practice. If you don't lose weight, I don't care. You're not metabolically fit. A lot of us don't have metabolic flexibility and
That's
we're
what I
not
was going to
metabolic
ask.
resilient.
So the
Yes.
people that are not losing, can it be like a metabolic or
Yeah, for sure.
hormonal? Yes.
For
Okay.
sure. Hormones matter, metabolic matters. I had a patient a while ago who wasn't losing weight, couldn't figure out why. Did a liver cleanse on her, helped the liver out a little bit more past what the GLP-1 did. All of a sudden, weight just dropped off.
Wow.
And it was just their detoxification pathways weren't open enough and working. I've used NAD for weight loss. So I know there's NAD is a very common talked about thing now. It's a B vitamin, works very well. It helps detox pathways, it helps energy production, fat metabolism. It works well paired with the
Yeah.
GLP-1s. So there is no this isn't like a one-stop shop to get stuff done. I mean, there's lots of other products out there that can help aid you. I had a patient just messaged me today. She's been on semaglutide, tirzepatide, retatrutide now, and hasn't lost a single pound. And she's been on
Oh,
top doses of everything. And of course, I feel awful. She's gone through the whole gambit. She has
oh,
felt better, but she's like, I'm not losing any weight. I spent so much money. Like, what's going on?
yeah,
Right now, it's like, well, we should try the liver cleanse. We should try NAD. We've been already managed our hormones. So again, some people do not see weight loss, and it can be very frustrating. And you're like, well, this doesn't work at all. And your friend's taking it, and they're on the lowest dose, and they're like,
right.
they lost 20 pounds. What the heck what's different? Is mine good? Is my stuff good? I get that all the time, and I like remind people like the GLP-1s in general are very good for you. There are some natural products that do make this. There's a my, probiotic called Akkermansia that actually increases natural GLP-1. Curb is another one that increases GLP-1. Now, these natural products increase GLP-1s. They do it for a very short time. Natural GLP-1s last seconds to minutes. The ones we're seeing, semaglutide, tirzepatide, and others, are lasting days. So they're
Right.
at much higher levels and lasting days, which is why we're seeing these massive benefits compared to taking a probiotic or taking some other natural substances, which again,
Yes. And I think too, we need to talk about,
yeah,
anything taken orally, that bioavailability is going to
of course,
decrease,
of course.
right? So
I
we
mean,
want to go right into the bloodstream.
yes, exactly. I mean, the
Yeah.
oral semaglutide, Rublis is just not. People aren't seeing the weight loss with it. They're not getting as much results. It's a very, very, very low amount that gets into your body. So you have to be a much higher dose. Typically, patients get a little more sick from that too. We prefer to obviously do the injections for patients because we see better weight loss overall.
So,
Now,
and I'm sorry, I'm so sorry
no,
because
go
I feel
ahead.
like we could keep talking over one another,
Yeah.
and I don't mean to do that to you. Um, so I just want to go back one more time because I get this all the time. So if
Hmm.
somebody doesn't lose weight, let's say in 3 months, would you
Yeah.
tell them like give it a chance? Like sometimes it takes people a year, or it takes them 6 months, or would you say after 3 months and if nothing's happening, would you just stop? Like what would you say there?
So really dose dependent, right? Now hitting the top dose, right? We're talking semaglutide 2.5 milligrams. Maybe we've hit tirzepatide 50 milligrams. I haven't lost a single pound in 3 months. Nothing budged. I need to do something else. I need to add something else. We use cagrilintide now in practice. This is a new weight loss peptide coming out. Works on amylin. It reduces appetite even further. I have patients say my appetite's not the problem. I don't eat anything. Like I'm still not losing weight. And then I'm looking back, well, what other things do I need to add? This is again when NAD would come in potentially to help improve that ability to
Yeah.
lose weight. So I would 3 months for sure. If you're not losing weight 3 months, it's not like magically month four is going to come and something's going to change. And after you change the dosing at month four, then yeah, something
Yeah.
might happen. But if you reach the top dosing and you haven't seen weight loss by 3 months and you're been at 15 milligrams for a month,
Yeah.
you're not magically going to start losing weight all of a sudden. It doesn't just work like that. You're already at the top dose. You should have
Right.
been experiencing some weight loss. So
Okay.
then something else that might work a little better. Again, not everyone's problem is not enough GLP-1. That's not the issue with
Right.
them.
Now
And
listen,
again,
your audio is getting a little muffled there. I don't know
oh,
if it's your phone or your glasses.
yeah, um, yeah. I just want to reiterate that we do have massive improvements in so many things that we have with the GLP-1s. I really do think that if you're not losing weight with them and you have lost weight and it's not working the way you want it to, there's still a lot of benefit from being on a GLP-1 in general. Even if you got to the max dose, you didn't lose weight, it didn't work for you, you had to switch to something else or try a different protocol. Going back to a low dose and staying on that can work really well. I've had patients who don't lose weight and put them back to the low dose and they still feel better, right? Because again, I'm having all these risk reductions, like all these benefits we have here behind me. And there's just so many things. I mean, now we're discussing and having improvements in fertility. It's one of the new big things we're seeing. So if you're on GLP-1, you now can see improvements in your fertility as well. So I would say, if you want to do something to improve fertility, even, my new thing is to start using the GLP-1s.
Yeah, your
Uh,
audio is getting a little unclear there. I don't know what.
Okay, that's fine. I got this.
Oh,
Um,
yeah, you got that sounds much better. Perfect.
so anyway, what I would say is that if you want to work on things like fertility, for example, I have really good fertility, from using GLP-1s. Now, this is a major part I'm using that for. Um, I want to continue to tell people that if you don't lose weight, it's okay because there are other things we're working on.
Yeah.
Maybe you get to the max dose, you haven't lost the weight. We have tried new protocol, but there are other things we can do to improve the weight loss that are not GLP-1 related. Again, I think GLP-1 is one of those things everyone right now should be on. There's a lot of use cases to it. Anything for longevity wise, we're talking about, metformin for years was the go-to. Everyone said metformin, this is the drug. Everyone should be on metformin. It's helping control blood sugar. We're seeing cancer risk go down, all of this. And we're now saying, well, you know what? GLP-1 is the new metformin. We're really seeing longevity from this. The metformin had previously thought had been great. GLP-1s now beat this again because they work across so many systems. They're working on the brain, they're working on the liver, they're working on the heart, reproductive organs. The immune system gets worked on. It's reduction of psoriasis with GLP-1s. We see reductions of the immune conditions, autoimmune conditions. We're seeing improvements in inflammation across the board. I think the number one thing that people should take away from this is your inflammation is one of the biggest things that we have to worry about as we age. And if GLP-1s can bring that down, risk factors are going to severely decrease across
Yeah,
the board.
definitely. So listen, would you like to take a couple of questions?
Oh, of course. Yeah, sure. Whatever you guys want.
Gosh, I don't even know where. I know you had so many. So out of fairness, I'm gonna go to the top and I'll just
Just
do.
start picking some little
Yeah, I'm just
answer
gonna do
here.
it. Okay. So Irina says, I heard that people that are nursing can't do GLP-1, but some people said it is too large to pass through milk. What are your thoughts? Any thoughts on that?
Yeah, I have thoughts. I don't want to use it in anyone that's breastfeeding. A few reasons. We don't really have an idea of what it's coming out in the breast milk. Again, it might be too big to pass through there, but maybe now the mom's not getting enough nutrients. Now she's going to be on GLP-1, and again, I understand that maybe there are some women out there that aren't worried about the weight loss that came from having a child. And they're like, it's fine. I'll be on a low dose GLP-1 just for the benefits of inflammation. I tend to think that women are going to want to start losing the weight as fast as possible. And in that case, they're going to deplete the minerals and vitamins and all the nutrients they need by taking a GLP-1 and doing weight loss a little too early, which is going to lead to mineral deficiency in that child. So I'm a little more cautious with my breastfeeding mothers just because I'm a little bit worried that these parents are going to, quickly get into nutrient deficiency, which is going to lead to that in the child.
Okay.
I can tell you that it might pass in the breast milk, but that's not my biggest fear. My biggest fear is just something happened to that parent before they.
Okay, perfect. Thank you for that. Okay, somebody says, and this is a great question. So, I know that you've seen this too. If somebody has severe side effects from a GLP-1, do you think it's safe to try a microdose?
That's a good question. Depends how severe the adverse effects are. We had patients who've had, my God, I had a woman who's doing 0.25 milligrams of semaglutide and was just vomiting, profusely. Switched to tirzepatide and there was no issues. So even switching to GLP-1 is a really great option. Microdosing is still fine, but depends what the severe, issues are. If you are so nauseous you can't keep food down at whatever dose you're at, it may not be the best option for you. I don't want someone to be nauseous all the time. But I
Right.
would say that microdosing is still an option. If the higher dosing made you really sick, didn't make you feel good, but you felt fine, the lower dosing, I said often, I would still keep them on a low dose as long as it wasn't causing major reactions. And again, this also comes down to some patients can get allergies and antibodies to GLP-1s. It does happen. If the major effect is they're going to anaphylaxis, can't breathe, yeah, I would say probably stop.
Yeah.
Do not continue that. I've seen that. I've had women tell me, well, I can not breathe a little bit. Is it still okay? I'm like, no,
Oh
absolutely
my
not.
God.
Just stop, be done.
Yeah, that's their clue. Yeah,
Yeah,
definitely
yeah,
stop. We done with that. Okay, let's do one more because and
sure.
here's what I'm going to tell you guys. I know that we all have questions. I would say whatever is not answered, please check out his Instagram page because you will probably find the answer. You'll binge it. You'll just start binging it. That's what I
Yeah.
do. Okay, so Natalie says, are there any indicators in blood work that would point towards someone being more likely to get the pancreatitis or the stomach stopping, or is that completely random?
Well, if we look at blood work, which I pull in every patient, amylase and lipase, the pancreatic enzymes we look for, by the time we see these up, it's really too late. I mean, maybe if they have high amylase or lipase enzymes before you start. If you're a type 2 diabetic, you already have a higher risk of those happening. That's really what the situation is. The people that we're seeing with pancreatitis and the gastroparesis that's going on are typically type 2. That's what the study's looking at. And in type 2 diabetes, you have these risk factors are higher. In fact, all these thyroid cancer is higher, pancreatitis is higher, medical gastroparesis is higher, diabetic neuropathy, it's a diabetic condition, NANION. All of these conditions we talked about that are adverse that we're worried about are happening more in type 2 diabetes. So there's a much lower risk in the rest of the population. So about 37 million people in the United States have type 2 diabetes or some type of diabetes. And those are the people that are higher risk. The rest of the people taking this stuff have a lower risk in general across the board. So you would have a lower risk in general. To be honest, nothing the lab is going to show anything specific to me that you're going to have a higher risk factor than someone else, other than you have type 2 diabetes, which increases all these risks.
Okay, wonderful. Okay, thank you, thank you, thank you. This was amazing. It was so good. Did not disappoint. So, if any of you that are watching, if you'd like to learn more about peptides that are available to you, I encourage you to reconnect with the person who invited you tonight. And we probably partner with LEMD. It's a telehealth concierge company that's truly setting the gold standard for peptides. From their nationwide network of experienced doctors to FDA regulated 503A pharmacies and third-party tested medications, LEMD checks every ethical box that I had whenever it came to offering quality care. So they specialize in longevity, weight loss, skin health, sexual health, and they even just came up with a GLP-1 friendly protein powder, which I love. Diagnostics and HRT are on the way. And we just want to thank you so much for spending your evening with us. And a huge thank you to you, Dr. Pensick, for sharing your insights and expertise. You can find both of us on Instagram, but go find him. He is fantastic. Just search Dr. Jason Pensick, right? And you'll just
Yep.
pop up there. You can't miss him. Look at his hairdo, look at his glasses. You were a joy and such a wealth of knowledge. We are so grateful for you, for everything that you do and all the time. And I just got to tell you guys, he invests so much time. If you follow him, he goes to conferences. I mean, he really, really just throws himself into making sure that he's up to date on all things peptide. And we are so grateful for it.
Thank you
Okay.
so much, Joey. Thanks for having
Thank
me.
you. Thank you. All right. Take care, everybody.
Have a good one.
You too. Bye bye.
All right.